So colloid and crystalloid types plasma expanders in previous class. The difference between these colloid type and crystalloid type plasma expanders is covered. So plasma expanders, is it colloids or crystalloids? The ideal properties of plasma volume expanders. I was telling you that isoosmotic with plasma distributed to intravenous compartment only. Second thing is it should be pharmacodynamically inert. It should not react with the other body parts or other bodily components which are present in the connective tissues like blood. It should be pharmacodynamically inert. It should it should be non-pyrogenic, or it should not be pyrogenic, because pyrogens which increases the body temperature, so it should not contain any pyrogenic, or it should not show any pyrogenic activity. It should be non-allergic. Any type of allergic reaction is very much dangerous for our body, so it should be non-allergic, non-pyrogenic, and non-antigenic. Antigenic, as if it will antigenic, so it will show the antigen antibody reaction in our body. So it not be so desire, not so much desire or peaceful for our body. So it should be non-pyrogenic, non-allergic, and non-antigenic. So it should have the isoosmotic with plasma, and it is distributed to intravenous compartment only. It should be pharmacodynamically inert. It should not pyrogenic, or it should be non-pyrogenic, non-allergic, and non-antigenic. There should be no interference with blood grouping or cross-matching. There should be no interference with blood grouping or cross-matching. It should be, this plasma expanders, plasma volume expanders should be stable, easily sterilizable, and cheap, as we can easily get it. So it should have no interference with blood grouping or cross matching. It should be stable and easily sterilizable, and it should be cheap, as we can easily get it. These are some volume expanders like human albumin, dextran, polygelin, DX40, DX70, hetastarch, etc. These are the examples of some plasma expanders in which this the human albumin, it is obtained from pooled human plasma, where 100 ml of 20% human albumin solution is osmotic equivalent of about 400 ml of fresh frozen plasma, or 800 ml of whole blood. So it is the human albumin is obtained from pooled human plasma, where 100 ml of 20% human albumin solution is osmotic equivalent of about 400 ml of fresh frozen plasma, or 800 ml of whole blood. It can be used without regard to patient's blood group and does not interfere with coagulation. It can be used without regard to patient's blood group and does not interfere with coagulation. Unlike whole blood or plasma, it is free to risk of transmitting serum hepatitis because the preparation is heat treated. There is also no risk of sensitization with repeated infusion. Okay. So human plasma is obtained from pooled human plasma. 100 ml of 20% human albumin solution is the osmotic equivalent of about 400 ml of fresh frozen plasma or 800 ml of whole blood. It can be used without regard to patient's blood group and does not interfere with coagulation. Unlike whole blood or plasma, it is free to risk of transmitting serum hepatitis because the preparation is heat treated. There is no risk of sensitization with repeated infusion. The 20% solution draws the holds additional fluid from tissues. Crystallized solution must be infused concurrently for optimum benefit. So 20% solution draws and holds additional fluid from tissues. Crystalloid solution must be infused concurrently for optimum benefit. Apart from burns, hypovolemia, shock, etc., it has been used in acute hyperproteinemia, acute liver failure, and dialysis. So, apart from burns, hypovolemia, shock, etc., it has been used in acute hyperproteinemia, acute liver failure, and dialysis. Dilution of blood using albumin and crystalloids solution can be used before cardiopulmonary bypass. Febrile reaction to human albumin occurs occasionally. So human albumin is completed. Then comes to dextran. This dextran. Dextran is a polysaccharide obtained from sugar beet, which is available in two forms: dextran 7, dextran 70, dextran 40. Here the dextran 70, dextran 40. The more commonly used preparation is dextran 70. It expands plasma volume for nearly 24 hours and is slowly excreted by glomerular filtration as well as oxidized in the body over weeks. Some amount of deposited in RE cell. Dextran has nearly all the properties of an ideal plasma expander except it may interfere with blood grouping and cross-matching. Though the dextran used clinically is not antigenic, its structure is similar to other antigenic polysaccharides. Some polysaccharides reacting antibodies, if present, many cross-reacts with dextran and trigger anaphylactic reaction like urticaria, itching, bronchospasm, fall in BP occurs occasionally. Anaphylactic shock, these are rare. So this is adverse effect of dextran because it may interfere with blood grouping and cross matching. And though dextran used clinically is not antigenic, its structure is similar to other antigenic polysaccharides. Some polysaccharides reacting antibodies, if present, may cross-react with dextran and trigger anaphylactic reaction like urticaria, itching, bronchospasm, fall in BP occasionally, anaphylactic shock, which is rare. So dextran, it is a polysaccharide which obtained from sugar beet, which is available in two forms like dextran 40 and dextran 70. The most commonly used preparation is dextran 70. So mechanism of action of these plasma expanders, we will follow this part in the next class.